So, what are the next steps as we await the vaccine that may bring society back to normal? To help us out with this, in our TIA Health medical segment, we are joined by Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to the show.
Thanks so much for having me.
Now, Dr. Raut, it seems that people are eager to take a COVID-19 vaccine, yet the virus continues to spread rapidly across the country. So what's missing here in terms of public health guidance?
That's a very good question. I think we've all been looking for some good news, and vaccines are certainly the good news here. So we'll take it. But it's still very much far off. And, the public, as we can see, are more likely to trust the vaccine right away rather than use the preventative measures we have in place right now, which is social distancing and wearing masks. And importantly, these are the procedures that can save lives right now rather than waiting for the vaccine.
Now, we also know that the government has been investing in expanding contact tracing services. So I wonder, has this increase in contact tracing also contributed to this recent spike in cases?
I think so. I think it definitely plays a role there. We have certainly increased the level and the strength of our contact tracing procedures here, and that can certainly boost numbers. A lot of the cases we are seeing, though, are really the cases around events. If you remember, when schools reopened, we saw a large number there, and certainly a large increase for 1 to 2 weeks after Thanksgiving as well. And so the concern here is, things are not in check. What are we going to see for Christmas? What are we going to see for New Year's?
Now, we've definitely got to keep an eye on that, Dr. Raut. But in the vaccine space, we do have some promising results. Moderna and Pfizer both saying that their candidates are showing 90 or 94% efficacy. So how long do you think it would take for a final vaccine to be distributed more broadly?
Yeah, so we're really excited about Moderna and Pfizer's vaccines here. I think we're still a long way off to distribution. Many countries already have had contracts with both Moderna and Pfizer, and the companies would likely have to delay until there's enough to fulfill all these contracts anyway. So if we're lucky, we'll probably see it in the spring, maybe even the summer. And certainly the effect, which is what we're looking for, would depend strongly on the herd immunity.
Now, in a previous conversation together, we mentioned that vaccines could be used to develop herd immunity. So I wonder, how long would it take for Canada or a province to develop herd immunity from a vaccine after it is released?
That's a very good question. So herd immunity is when enough of our population has gotten the vaccine in this case. And so that would, of course, prevent further infections and spreads. Now, we know for in the influenza vaccine world, we're looking at a herd immunity closer to 80%. For coronavirus, we're not sure, but many of the countries are assuming that with social distancing and masking, maybe a 50% herd immunity would suffice. And so my best guess based on that, on how we could proceed, is likely November 2021.
Now, I want to get into the lockdown procedures as well, Dr. Raut. We're seeing lockdowns, unique lockdown procedures pop up in provinces depending on how severe the COVID-19 hotspot is. But is this enough to stop this rapid spread of the virus at this time?
It's very difficult because lockdown procedures, are helpful as an absolute resort. It's in many ways, it's like using a sledgehammer to work your touchpad. It's helpful, but certainly it can hurt a lot of lives and livelihoods in the process. So short term, it can be helpful, but really long term, what we have to look at is more concrete and maybe even national plans here.
Now, as a physician, as a medical specialist, what would be your advice in terms of what else needs to be done in the political space to tackle this virus?
I think some of the next steps would really be nationally agreeing on a unified framework for COVID responses, provincially maybe agree on the national framework and what to do with each step. And let's say if a place is in a red zone, what exactly happens. And finally, on a community level, looking at enforcing and legislating those social distancing recommendations and fining those who don't follow them accurately.